Ectopic pregnancy. Ectopic pregnancy, which is a significant obstetric emergency, an important cause of maternal morbidity and mortality, particularly in early pregnancy. This presentation will focus on the definition, risk factors, clinical features, diagnosis, management, complications, and the vital role of the nurses in early detection and prevention. The main objective of this presentation is to enhance understanding of ectopic pregnancy and its impact on maternal health. Especially, this presentation aims to define ectopic pregnancy, identify common implantation sites, recognize major risk factors, and describe key signs and symptoms. In addition, essential diagnostic methods, medical and surgical management options, possible complications, and strategies for prevention and early detection will be discussed, with particular emphasis on nursing practice. Ectopic pregnancy. Ectopic pregnancy is defined as the implantations of the fertilized ovum outside the normal uterine cavity. In more than 90% of cases, implantations occur within the fallopian tube. It is considered the main causes of maternal death in the first trimester of the pregnancy because the extrauterine structures are not designed to support fetal growth. Ectopic pregnancy poses a serious risk to maternal health if not diagnosed and managed early. Common implantation sites, also known as type of ectopic pregnancy. The most common site of ectopic implantation is the fallopian tube, particularly the ampullary region. However, implantation may also occur in less common sites such as the cervix, ovary, abdominal cavity, or even within a previous caesarean section scar. This is a short diagram of it. It is divided into two parts: 95% tubal pregnancy and 5% non-tubal. In tubal pregnancy, 80% of ampullary portions of the tubes and 12% isthmus of the tube. In non-tubal pregnancy, it includes abdominal cavity, internal os, interstitial part of the tube, ovary, previous caesarean scar, and caesarean scar pregnancies. Awareness of these atypical sites is important for the nurses as they may present with unusual clinical features and diagnostic challenges. Risk factors. Several risk factors increase the likelihood of the ectopic pregnancy. Only about 50% of women diagnosed with an ectopic pregnancy have identifiable risk factors. These include previous history of ectopic pregnancy, pelvic inflammatory disease. It is tenfold increase the risk, causing tubal damage, prior to tubal surgery, and the use of assisted reproductive technology. 2 to 3% of higher in IVF compared with natural conception. Smoking and in rare cases, intrauterine devices use are also associated risk factors. Identifications of these risk factors during history taking is a key responsibility of nurses in antenatal and emergency care setting. How to diagnose of ectopic pregnancy? In history, period of amenorrhea, natural conception or assisted reproductive technology use, smoking, and signs symptoms. Clinically, ectopic pregnancy often present with lower abdominal or pelvic pain, amenorrhea and abdominal vaginal bleeding. Shoulder tip pain may indicate intra-abdominal bleeding due to diaphragmatic irritation. Diagnosis of ectopic pregnancy relies on combination of clinical assessment and investigation. Transvaginal ultrasound is the primary imaging modality, while serial beta HCG measurements help to assess abnormal pregnancy progression. Pelvic examination may reveal adnexal tenderness or mass. Cardiocentesis is rarely used today but may be considered in selected emergency situations. In general examinations, we can identify following signs: hypotension, tachycardia, reduced capillary refilling time, rise respiratory rate, pallor. In abdominal examination, intra-abdominal bleeding, generalized tender, distensions of the abdomen. Vaginal examination on rare occasion in the presence of an ectopic pregnancy, residual cast can mimic product of conception. Ultrasound diagnosis. Transvaginal ultrasound is the single best diagnostic modality for evaluating or what suspected ectopic pregnancy, both tubal and non-tubal. In pregnancy of unknown location, whenever there is no signs of either extrauterine pregnancy or retained product of conception on transvaginal ultrasound despite pregnancy test. In tubal ectopic pregnancy, 30% of ectopic pregnancies are seen on ultrasound scan on their first scan, and well over 90% before surgery. We can identify two signs. This is the bulb signs and next is Badger signs in ultrasound scan. In examinations of the uterus, tubes, ovary, peritoneal cavity, we can identify fluid in hepatorenal pouch, pseudogestational sac, fluid in POD, and double ring size. This is the ultrasound scan report of ectopic pregnancy. Profound referral and coordinations of care are essential nursing role at this stage. Non-tubal ectopic pregnancy, ultrasound scan diagnosis, interstitial pregnancy, cornual pregnancy, cesarean scar pregnancy. This is ultrasound scan report: interstitial ectopic, cornual ectopic, ring of fire signs, scar size ectopic, abdominal ectopic, and ovarian ectopic. Management. Management depends on the patient's clinical stability, gestational age, and investigations findings. Medical management with methotrexate is suitable for stable patient with early unruptured ectopic pregnancy. Surgical management, including laparoscopy or laparotomy, is indicated in cases of rupture or hemodynamically instability. Expected management may be considered in carefully selected asymptomatic cases. Nurses play a critical role in monitoring patient education and emotional support throughout treatment. What is complication? Complications of ectopic pregnancy. If not managed properly, ectopic pregnancy can lead to serious complications such as tubal rupture, massive hemorrhage, and hypovolemic shock. Long-term consequences may include impaired fertility and increased risk of recurrent ectopic pregnancy. These complications highlight the importance of early diagnosis and timely intervention. Prevention and early detections. Preventions and early detections are key strategies in reducing morbidity. Early treatment of pelvic infections, smoking cessations, and early antenatal blockings are essential preventive measures. High-risk women should be closely monitored in early pregnancy. Nurses have a vital role in health education, risk assessments, and early referral. Ectopic pregnancy is a potentially life-threatening condition that requires early recognition and proper management. A sound understanding of risk factors, clinical features, and management options is essential for nursing professionals. Though early detection, patient education, and multidisciplinary collaborations, nurses can significantly improve maternal outcomes. Thank you.